Somebody asked, what about heartburn? And yes, I do have a resource for heartburn, GERD, reflux, whatever you want to call it, that burning sensation that can make a day pretty miserable. This was actually an acupuncture study that went a week long, so it would take you a week to see if the same result would happen with touch. It couldn't do any harm. So what they did is for a week, they did daily acupuncture on these points. Conception vessel 12, which is halfway in between your sternum and your belly button, right in the middle. Circulation sex 6, which is the second knuckle, right there in the center. And they would do the left side and the right side. Stomach 36, which from the bottom of the kneecap is 4-finger widths down in the soft spot over here. Stomach 36. Spleen 6, from the tip of the inside of the ankle bone, 4 fingers up. Spleen 6. Left and then right. And they did these points for a week straight. There were 60 patients involved in the study. 30 of them received acupuncture, and 30 of them received 2 Prilosec a day and 3 Mosapride a day, which stimulates gastric motility. At the end of the week, symptom relief was about even, significantly relieved the pain of heartburn. And then they did an endoscopic examination, and both groups had improved endoscopic examination. Redness, burning was abated. No significant difference between the groups. They followed up in 4 weeks. In the medication group, endoscopic examination showed a return of redness, burning in the esophagus. And in the acupressure group, it did not. So it seemed to have a lasting benefit. I would also suggest that you do a hiatal hernia correction. And that is starting from the left shoulder. You go into the edge of the ribs here, poke your fingers, try to like maybe scoop under the rib, pulling down towards this hip. And so you're kind of tractioning that tissue. That's the stomach up there. And we do a deep breath in, and that pushes our diaphragm down. And then we do a deep breath out. And we're pull towards the hip as that diaphragm is going up. You'll be pulling it back down. And it's a really simple correction and can give you tons of relief.